Thank you very much. Yes, this is a long slot for the end of a very long, hot day. So I'd suggest that you interrupt as much as you want, shout out, ask questions, and the more questions you ask and the more discussion we have during it, then the fewer slides you have. So it's all good. So does anybody know what this is? Does anybody want to make a guess what this is? It's one of the treasures of the Ashmolean Museum in Oxford, where I was always being taken as a child because it was our nearest proper museum. And it's called the Alfred Jewel. And as a child, I just thought it was very pretty. And I have now just recently realized that this is kind of sums up what I'm trying to do with my whole life. And I'll tell you why at the end, but you might want to think about it and see if you can preempt me. So yes, I'm not an academic. I'm a filmmaker, or I used to be a filmmaker. I think of myself as a communicator. And basically in filmmaking, it involves a lot of kit. This is our typical traveling kit of 27 cases of film equipment, which we carry out into the desert or up into the jungle, and we're hiring mules to take us in places. We film in pairs, usually, just me and a cameraman, so it's a lot of kit for the two of us. But sometimes we do big shoots with huge amounts of kit and whole crews, and you have to walk out and direct that. But all the time, what we're trying to do is essentially communicate information, because I was a factual filmmaker. And so that's why I thought when David Spiegelhalter tweeted saying, I need somebody to help me spend £5 million at Cambridge, I thought, oh, he's wanting communication. I can do communication. I'll sign up for that. And so I did. And I didn't realize that at the Winton Centre, what we do, this risk communication, is really surprisingly different. So we're trying to communicate evidence to people who have decisions to make. And this is an example of what we did. So we were making graphics overnight when the UK's regulator first discovered a link between the AstraZeneca vaccine and some blood clots. And they asked us to make a graphic to explain to the governmental panel who make decisions about vaccination what that link might mean. So we quickly made up these sort of PowerPoint slides, and then they were shown that afternoon on television to the public in the national briefing. So what I thought I'd do this evening is just talk a little bit about how this change from communicating in film to a public audience of people who didn't care before they started watching, but needed to be entertained from our point of view, to communicating information for people who have a decision to make that could be a life-changing decision, how those are very different and how that changed my thinking. So I think this is the first and key question that every communicator needs to ask themselves. And it sounds really simple, and I didn't actually ask myself this very often when I was working as a filmmaker. I thought I knew what I was doing. I was making factual documentaries, but the media is an entertainment medium. So what were we aiming to do? And I think you can only really tell what you're aiming to do if you think about what your measures of success are. So we had a lot of audience feedback. It came in between 10 o'clock and 11 o'clock every morning, which was a very tense moment in the office. And the first thing you get is a viewing figure. So you get your absolute overnight viewing figures, and as a percentage share of all the viewers of television that night. And we get a demographic breakdown of that later in the day, because it's no good making something that nobody's watching. So our number one sort of thing that we were trying to deliver was something that people wanted to watch. But viewing, luckily, isn't everything. The second thing we'd get was an AI figure, Audience Appreciation Index, which is a measure of how much people liked it. So this comes from a panel of people who were asked to rate things, and it should be around 90% if you're making high-end documentaries. So these are important measures, but they're kind of measures of popularity, really, in a way, which is what you'd expect from an entertainment medium. But at the BBC, luckily, we did also get other really important data in. So we got ratings from this same panel on things like whether what they'd seen felt fresh and new, these kinds of things, which the BBC call distinctiveness measures. So that's good, because it means that we're not just trying to make popular stuff. And finally, and importantly to us as factual documentary makers, there were questions about the content. So whether people learnt something new, whether they were inspired to go out and try something different. So we were trying to entertain, but we were trying to do it in an original, interesting, and useful way for our audience. And it sometimes felt as a filmmaker that these were slightly in competition, that you'd have bosses who wanted more of one thing than another. But at least they all came into the mix. So I think that was an important and well-designed set of criteria that measure success for us. And I think now, if you're trying to communicate, it's important to have a think about what measures of success look like for you, because that'll tell you what kind of communication you're doing. And not every piece of communication is part of the entertainment industry, obviously. So our sort of performance indicators were really overt, and we lived and died by those ratings, which I think was good, because it drove us towards what were good outcomes. But if you don't have somebody setting those for you, you've got to set them for yourself, which means that if you're communicating in a world that's outside of that entertainment or media sense, you've got to think really hard about what you are doing and what success would mean. And I think that very broadly, most factual communication does fall somewhere between the aims of informing or persuading. And that's a difference that I hadn't really thought about as a television maker. I had thought that I was informing. I mean, it's one of the remits of the BBC, is to inform and educate and entertain. But actually, I knew what I wanted my audience to think at every point along a film. I was controlling their emotions through the music, through the editing, through the pictures, through the script. I had absolute control. And in fact, if you work on very high-end stuff, especially for the States now, they'll show it to an audience, and the audience will have dials that they're moving with their emotions, so that you can say, 3 minutes 30 in, they're starting to dip off on this emotion. You can script it up a bit. So it's actually, I think, a much more persuasive medium than I'd imagined it was. So I had a little think about how you can tell whether you're informing or persuading. And I think you can think about it in terms of what you're trying to get the audience to feel. Are you trying to get across a message? Or do you want to get across information? And that, for me, was a real indicator that I always had a message at the end of my programs. I mean, the audience loves a take-home message, right? So I wasn't just trying to get across information. Do you want people to believe you or understand that information? Again, I think that's really crucial. If you just want people to believe you, you're not really trying to inform, you're trying to persuade, or it's a sign that you might be. If your real outcome measure is how many people did something or believed something, then you're trying to persuade. If you really don't care and you just want them to be better informed, then maybe you're informing. And this bottom one about trust and trustworthiness, I think, is also really key and really interesting difference, which I totally hadn't thought about. One of the values of the BBC that we all have on our passes was trust. We want our audiences to trust us. But now, through the philosopher Onora O'Neill, who I recommend her TED Talk, I've realized that trust isn't in your gift. As a communicator, you can only set out to be trustworthy. Trust is something that your audience gives to you on the basis of your trustworthiness. We don't want people to be trusting untrustworthy people. So if you're trying to get people to trust you, the only honest way of doing it is to be trustworthy. So of course, this is a spectrum. It's not all either you're purely informing or you're purely persuading. At one end, we've got pure informed consent, the kind of thing that is absolutely legally mandated in a medical scenario. You can't persuade your patient to take a particular course of action. You have to inform them and they make the decision. At the other end, you've got pure marketing, actual persuasion that people are setting out to do very overtly. But where does everything else sit? Where do nudges sit? Where does boosting sit? Is boosting even on this scale? I don't know what you all think. I'm interested what Ralph thinks, what Gert thinks. I think nudging is essentially another word for advertising. Is it not? Is it not a rebranding of advertising that makes it socially acceptable to do if you're in a public service? Boosts, I'm only just learning about what boosts are. I mean, I think they are further down the informing end of the spectrum, but maybe they fall outside of this because maybe they're not communication, maybe they're education. But I think every time any one of us sits down to communicate, we have to think about where we are on that spectrum, because it means the tools that are available to you, really, in your toolkit, ethically, are quite different. And I think you have to think of the ethics as well as you move towards persuading people. Why are you doing that? Most of the people who come to us in the Winton Centre for advice on how to communicate risks or evidence ask how they can get people to do more of something or less of something, or ask to be trusted more. And they only think of communicating when there's something in it for them. They, as an organisation, want people to do something or people to think something. And I don't think that's really behaving like a public service. If you're a public service, you set out to communicate when people need you to communicate. You're there to serve their needs. So I think if you have a think about whether a decision has been made, has your organisation made a decision and you want people to, conform to that decision, that's very different from if you are leaving the decision open for them and you want to help somebody make that decision and you genuinely don't care what decision they make. What are you trying to maximise? Well, at the Winton Centre, we're trying to help people who have a decision to make, and we're trying to improve things like decision satisfaction, trying to reduce decision regret. Those are our kind of metrics. And we're trying to communicate quantitative information. That is our kind of bread and butter. That's the main thing that we're trying to communicate. And I used to think that the difficult bit of that would be the communication. I thought that's why the centre needed communicators so that we could think about how to communicate the facts and figures. But actually, I've discovered that the communication is by far from the hardest part. Actually, what we spend so much of our time and effort doing is trying to work out what to communicate in the first place. It's not as easy as here are some facts, we can just look them up in a scientific paper, and now we're going to try and communicate to them. My experience now is that actually we spend a lot of our time, and we actually have a joke about it, arguing about what is truth. And we say any time the conversation has turned to what is truth, that is the time to stop having that conversation. Because so often we just don't, there is no such thing as the truth in this situation. What we're trying to communicate is actually, the current evidence. And what we actually know at any one time can be really, really full of gaps, lots of uncertainties. But also, the things that we think we want to communicate aren't actually what the audience wants to hear. So this is an example of the kind of thing that we do and what I mean. So we've been making decision aids for the NHS. And these are designed to support different healthcare decisions that patients might make. And they give them information about their treatment options, about the risks and the benefits of each treatment option, including doing nothing. And the two time-consuming bits of making these are finding out what information is useful for people who are making these decisions. So this involves lots of interviews with current patients, past patients, members of the public who might be future patients, and then finding that information. So here's an example from cataract surgery. Cataract surgery is the most common surgery in the world. There are hundreds and thousands of these done every year. And this is what the standard measure of success is that's cited in all the papers. So change in visual acuity from baseline in some rather weird metric. And you'd think that maybe the communication aim here would be to convert that metric into something useful and to maybe give a before and an after. But actually, what was important was that this was giving an average. And the average wasn't telling the story. That's the first lesson. So when we talked to lots of people, there were lots of people whose eyesight got worse. Well, some people whose eyesight got worse after cataract surgery. If they'd been just told the average improvement, they wouldn't have had a concept that it could have gone down. So actually, it was really important that we got the figures for how many people's eyesight got better and how many people's eyesight got worse, and the number that stayed the same. And that is actually not easy data to get hold of. This is not the sort of thing that papers are written about. They're all trying to get that, precision to the third decimal place of how much visual acuity, on average, improved or changed. But actually, there's even more to it than that, because visual acuity is a nice, easy, quantitative metric that opticians or ophthalmologists can measure and like to measure. But it turned out, after we did some interviews and we read some papers on the qualitative side, that actually sometimes visual acuity as measured by the machines improves, but the patient has all sorts of glare and shadow issues with their vision. So as far as the patient's concerned, their vision hasn't improved. The machine might say your vision is clearer than before, and they'll say, well, no, I can't see anything. There's a massive great shadow in the way. And this, again, I think was really important information to find for the patients. Well, for all of us, really. Because if you'd just been told that some people's visual acuity got worse, and then you went to your ophthalmologist and they said, oh, your visual acuity's improved. And you said, well, nobody told me that it could improve. You told me it could get worse or it could stay the same and it could improve, but then you didn't tell me that even if it improved, I could be suffering what I think is worse eyesight. And so these kind of things, I think, undermine people's trust in the information they're being given if it doesn't feel like it then applies to them. So, you've got people feeling angry, they're feeling betrayed, and you're not being trustworthy if you're not giving them all the information that they really needed to make that life-changing decision about whether to have their eyesight messed around with. So it really matters to find the right numbers and to find what numbers would possibly help people in this situation. But then we have that problem of trying to communicate those numbers. And again, I was so naive about this. I thought, okay, so we're now trying to help people understand what 10, 20% means. And so I thought, all the kind of data viz stuff, this would help. But then I started thinking, well, numbers have a really important property for us. We use them because they're precise. They have precision. But that's really all they have on their own. This is a precise number. If you're a professional in web design, you'll probably use hexadecimals for colors. If you work in the print design, you'll be using CMYK codes or Pantone codes. So you're used to converting numbers to colors. But the rest of us aren't. So this is very precise. It's very useful. It tells you exactly what color that is, but only if you can translate that color. And so we might think about risks in numerical terms, and especially if it's in an area that we're familiar with, we think of those numbers and we understand those numbers. But most people will be unfamiliar with that context. For them, those numbers will just sound like that does to you. So our job is actually trying to do something more subtle than just convey what 10% is. So numbers make more sense when they're in a context that you understand. Money is a context where we're used to using numbers. So you'll all have a sense of what 100 euros or $100 or 100 pounds means, and you can see quickly that the context really matters. So 100 euros is a very expensive bar of chocolate, a very cheap laptop. It's a lot of money for a young person, and for a CEO, it's just a decent bar of chocolate at lunchtime. And in that context, it's really kind of obvious. But in other contexts where you don't have that familiarity, now you can see that the context is really important. So if you look at that color in the middle of the circle, how can you describe that to somebody accurately and precisely so that they can grasp that color if they can't see it? And that's what we're trying to do as risk communicators. They can't see that risk. They can't see it like you can see a color. And we've got to try and transmit that information to them. So that is 6D46C4. And you might try and use words to describe it, but the words that you're using are always going to be like analogies with something else, particularly another color. You know, it's a bit bluer and a bit darker and it's a bit purplier. You have to have some concept of the colors in order for your words to make sense on that. And your words can't be precise. If you try and describe this color, again, you might say it's a bit paler than the outside, it's a bit of a pinkish purple, you've got the same problem. And of course, you won't be surprised to learn that those are, of course, exactly the same color. And you can see that the context around it makes a difference to how you perceive it. And you'll also understand that everybody in this room is possibly seeing a different color. So we've all got our own subjective idea of that color. We accept that. We accept that some people like that color and some people don't, or you might like it on a dress but not on your car. You know, you understand how that works, and exactly the same for risk. So we can use colors, like web designers or any designers, to be very precise. And that's important. But we also have to try and get across a lot more than just 10 or 20 or 13.5. So some of our work at the Winton Centre has been on how to try and help communicate these numbers in a way that gives them context. So we're not trying to just give people something they can remember. We're not giving them a test on, you know, do you remember it was 13.3? That's meaningless. What we want to do is try and communicate a concept that they can understand and in a way that's not persuasive. So this is really, now I was starting to think, okay, damn, this job is a lot harder than I thought. So we talk to people about context, and we talk to them about the context in every particular scenario where we're trying to communicate, because we need to understand what people already have in their head that we can then draw analogies with and put in context the current number. So we ask people questions like these. You know, what would feel like a high chance? What would feel like a low chance? When we started doing this, we were trying to get people to put numbers on it. So we wanted people to say, oh, 5% feels low for this, 15% feels high for this. Nobody in any of our interviews ever put a number on it. What they did was come up with a scenario. So when we did this during COVID, and we were asked to try and help communicate people's personalized risk of dying from COVID, people would say, oh, low chance, that's a healthy young person. High chance, oh, that's an old man with, you know, several comorbidities. Because they knew what the risk factors were from the media. So they had in their head what low risk and high risk looked like, and to them it looked like these personas that they could visualize. So we thought, great. Okay, so now we understand what they're thinking about. What does risk look like to them? And now we can translate that in a sort of Rosetta Stone fashion. So we've done that for COVID. We created a risk ladder, which helped people put their natural perceptions. So we created personas that people could imagine that represented the different chances. And as I say, we didn't know what the chances were in that time. It was back in 2020. And that meant that on this side, we could then put your risk is here. And that helped people then understand where they were in comparison to other people that they could imagine. And so we did the same with earthquakes. So we just recently done this study where we were helping people understand these really low earthquake figures. And I put myself a note up there because somebody asked about relative risks earlier. And would relative risks ever be useful in communicating risks? Well, I think they might be, but so the problem is, if you're communicating really low probabilities, like earthquake probabilities, then you can get yourself into a situation a bit like the L'Aquila earthquake situation. So in the L'Aquila earthquake situation, the absolute risks of an earthquake happening, of damaging earthquake at that particular point, at that particular time, was really, really low. I mean, they always are. Even though they'd had some foreshocks, it was still really low. But it was about 150 times above background level. So if you just give the absolute levels, I think I would feel very cheated. And in fact, lots of people did feel very cheated, having just been told that the risk is very, very low. In absolute terms, it is. But I think knowing that it was 150 times above background level was salient information in that context. So when we did this experiment, we did try giving people relative risks as well, and we found that people did feel that the relative risks were persuasive. They said, if you want people to evacuate or something, yeah, relative risks are great, but they might scare people. They sound big. So actually, we tried to kind of incorporate that concept. So you are putting the context around it in this scale, and you could put, a typical week in your town on this scale as well, and then you would see how much higher it was than a typical week. So I think that, yes, relative risks can give important context, but again, you do have to be very careful because they do sound very, very big. So I think these are useful ways to communicate numbers, but we don't always have good numbers to communicate. During COVID, again, apologies for all the COVID examples, it's been quite a fixation in the last few years. I was asked to join a group nearish the start of the pandemic that was helping feed in science advice to the UK government. And these were the questions that obviously people wanted to know the answers to. And I was listening to all of the experts in the room who were talking about their research and what they knew and what they didn't know. And there was a lot that was unknown, and nobody could put numbers on any of this. But that didn't mean that they knew nothing. So they had senses of magnitude, they had senses of relative proportions, but they didn't have numbers that we could communicate. So the challenge was, how can we communicate relative magnitudes and proportions without absolute numbers? Well, what we thought we could do would get some rough numbers and then use those to make a kind of visualization. We'd never be communicating the actual numbers themselves because, as you all appreciate, as soon as you put a number on something, that immediately becomes a headline, becomes incredibly controversial. And these were very imprecise numbers. But then, as I said, I came to this, like before, thinking, okay, I'm here to do the communication advice. And everybody was like, oh, how are we going to get the numbers? Yes, it's always the problem. So the solution, I thought, was to do an expert elicitation. I'd never done one of these before, but I'd heard about them. So you go out and you ask a lot of experts And then you kind of do various processes, a bit like wisdom of the crowds, to try and hone that down to get a sense of what experts think. Of course, we couldn't really, in the time and the fact that we were all locked down in our bedrooms, do kind of interviews all over the world with, 2 hours with every world expert. So we had to do an online, rather quick process. But the first thing we did then was to draw out what all the different pathways might be and what all the different mitigations might be. And to be honest, this took us weeks of arguing just to get this far. It was back in 2020. And then we set out to ask as broad a group of experts as we could what they thought the magnitudes were of what was going along each of these pathways and how much each of those mitigations might affect it. You'll appreciate this is quite a lot of variables, and these are experts dealing with a pandemic. So this was quite a big ask. But we did it, and we created this huge Qualtrics survey, which was very responsive. And we cut up that pathway so that experts were able to just do a little bit that conformed to their expertise, or they could choose different bits to do. And we asked them quite a lot of questions, but essentially we asked them two kinds of questions. One was these sort of splits, how much at a point how much virus would go out in different pathways. And then the other kind of question was how much would make it to the next stage, the next node, under various conditions. And we asked people to give 95% confidence intervals throughout. We didn't want them to give us sort of point estimates. And we did it in 2 different rounds of experts, so we expected there to be biases involved that we would iron out through doing multiple rounds. We also asked them to give us their references, to describe what evidence they were basing this on, their assessment of the quality of the underlying evidence, their rationales, their assumptions. So everything we thought we should know about their knowledge. Now, in the last couple of days, you've been talking quite a bit about people's abilities with probability. These are experts working in numerical subjects. And these are the sorts of results that they gave us. These graphs are not that easy to look at. So I don't know which of these is a pointer. Anyway, at the top, each of these was a question about the splits, and each of the blue lines or dots is an individual expert's answers. We asked them to give us ranges. Some of them just gave us a point estimate. So you can see that this top person said it's 100% aerosols. Absolutely no uncertainty about that, 100% aerosols. Another expert down here is giving us 0% aerosols, basically the next expert along. And somebody very confidently saying exactly 40% aerosols. And then somebody really usefully saying between 0 and 100%, which is a 95% confidence interval that I would suggest is impossible. So I started to sort of tear my hair out a bit, thinking, God, these are quantitative scientists. Do they not understand the concept of probability? Do they not understand the concept of a 95% confidence interval? No, basically. And we had absolute disagreement between experts. So what are we going to do about that? We've got, middle of a pandemic, people relying on this. We've got experts saying 100% and experts saying 0%, and somebody saying 0 to 100. And actually, these were experts that had been working with each other for months and didn't realize that they disagreed. They had been talking cross purposes, all been, talking. It wasn't until we put numbers on it that they realized, what, you think it's 0? No, it's 100%. So this was an interesting moment. And so I looked at the free text rationales, where we'd asked them to explain their assumptions and their rationales, thinking maybe some of them have, the same rationale, they've just put in the numbers backwards or something like that. No, their rationales explained exactly that they had precisely the opposite view to each other. So what we did is, where there wasn't disagreement, we combined their ranges into a distribution, and we took a 70% interval, that green bit, from it. And then in the next round, we asked the next lot of experts likely do you think it is that the actual answer falls inside or outside or within that range? Yeah, sorry, above, below, or within that range. And where there was disagreement, we divided it into camps, and we asked people to start with, do you think it's more than 50% this or less than 50% this? And then we hoped, with a little bit of kind of explanation of probability as well, that this would help iron out some of these problems and that we'd be getting more sensible answers. We didn't. So we gave them the green bit. We asked them to move their sliders around. We gave them all the references and all the rationales from the previous round and the assumptions so that they could build on that. We didn't actually resolve any of these camps of disagreement, or very few of them, and we found some more when we had more experts. And it wasn't by subject area either, so that was challenging. And we had the same issues with probability. So this is not a thing that you can say the public have an issue with probability. Everyone has an issue with probability. But we did, miraculously, I'd say, the majority view of every one of those 123 variables actually made logical sense and fitted into a working diagram. So from that, what we did was use colour to represent magnitude. So nobody ever saw a number, but we know that darker colours are more salient to people, they stand out more, they naturally, instinctively show more of a something. So we had this diagram going from an infected person to an uninfected person, and you could change all of these little tabs, brilliant designer at the BMJ, and you could change any of them, and the colours would change, and the flow would change, so that you could, without displaying any numbers, get across the relative magnitudes of the different pathways and how much different mitigations are thought to affect them. Yeah?
I'm sorry, I missed. How did you resolve the differences in opinions of experts?
We just took the majority view in each case. Yeah. Yeah. So we made that, and it was designed to be embedded on websites, and it was. And that raised the question of whether we did a good job. How do you measure success? We can look at the metrics that we use in the media, the sorts of things, it was getting out there, it was being translated, it was being embedded into journalist sites, it was being tweeted about. But I guess the important thing is that how people use it is up to them. That's the point. We weren't trying to get people to wear masks. We weren't trying to get people to stop doing table wiping or anything like that. We just wanted people to have the information. Because I think one of the fundamental things and one of the most possibly difficult things to get used to is the fact that if you're informing, you really shouldn't care what people do with that information. And the reason is that everybody has different things that they are taking into account when they're making decisions that you can't anticipate. And I saw something recently that really made me think about this, and that's this. These are figures from the most recent NHS staff survey. So it had nothing to do with risk communication or anything. I just thought it was really stark, because they asked staff at the NHS whether they agreed that the organisation acted fairly with regard to career progression and promotion. And the data, you can split it by all sorts of demographic factors. So here, if you split people's feelings of fairness of the organisation by ethnicity, I think it's sad and shocking how much people's feelings about that organisation differ depending on their ethnicity. And I suspect that's due to people's experience within that organisation that's affecting their perception. And you can split that data in different ways as well. You can do it by age. You see the same kinds of differences in different demographic groups. And I think it's really important to bear in mind that other people experience the world around you in a different way from you. And you might be completely unaware of their perspective and their experience and the reason why they feel differently from you and they've had different experiences to you. And I think that absolutely feeds into some of the really important fundamentals behind what we communicate, which is especially whether you trust a piece of information or not. If you have a think about whether, if you were offered, say, the Russian Sputnik COVID vaccine, or a vaccine from the North Korean government, and they told you it was highly effective, absolutely safe, would you be lining up to take that vaccine? And yet, governments all over the world made exactly those statements and expected us to line up and take the vaccine. And if you didn't trust that statement, some governments were quite castigating about you. And yet, I think trust is only gained, as I said, by being trustworthy. And if you set out to persuade people, are you being trustworthy? And if you, once you've undermined people's trust, then you have problems. So I'm sure all of you know, in here, know the important role of trust. This is just from our figures when we were doing surveys during COVID. Horrible graphic, but every column is a survey that we did in a different country or a different time period in 2020. And the coloured, the depth of the colour on each square is how much that factor affected people's hypothetical tendency to take the vaccine, intention to take the vaccine. Vaccines didn't exist at that point. And I've pulled out, on the left-hand side, the ones that have the greatest effect. And so there are 4 that affect people's perception of the risk, you know, being older, being male, perceived risk of infection, and worry about COVID. We know that those are about risk perception. And then the 3 about trust in institutions that might be communicating about COVID. So trust, we know, is absolutely key to people's intentions to follow advice or take information to a decision. And we also looked at why people trusted or distrusted different people, communicators. So I read through a few tens of thousands of free text, and I pulled out how many in this column. The biggest column was people's trust being based on the source or the perceived motivations of that source of information. So they were saying these kind of things. So green was people who trusted it based on the source, and red was people who distrusted it because of the source. And this is about the government. We did it for social media, we did it for different groups. And I think that really relates to the aims of informing versus persuading, because people are looking at the motivations, and then they're trusting or distrusting based on those motivations. The other 2 categories here will not surprise you, I'm sure. Information consistency with others, with their experience, with their beliefs. And one that might a little, quality of the evidence. So uncertainty and whether the evidence, they thought that was the best available at the time, that kind of thing. And that quality of evidence thing is something that we've come across again and again in our experiments. And I just wanted to bring that up because I think it's, again, really relevant to trustworthiness. So we did this experiment, God, it's COVID again, sorry. We did this experiment taking this rather nice risk communication graphic from The Lancet, looking at the communication of, the amount of protection that eye protection gives you against transmission. Again, way back, ignore the numbers. And the Lancet kind of followed best practice. Actually, it's not showing very well. They did have entire icon arrays. Sorry, when it's projecting, you can't see it because it's too pale. So they had an array of 100 little people, and they coloured in the right number. But more critically, for this experiment, they've got this label of quality of evidence. So we did an experiment where we took this graphic and we modified it so that that label either said high or low, or it wasn't there at all. And then we asked people a load of questions. We asked them objective comprehension, so we tested whether they remembered the numbers. We tested whether they remembered which was more effective, or how effective it was. And we asked people questions about how trustworthy they thought the information was. And so perceived trustworthiness, as you'd expect, they thought the one with a high quality of evidence was more trustworthy information, one with low quality, lower. And the perceived effectiveness, interestingly, they also I don't know whether they downgraded it, because I don't know where your midline would be, but they thought it was more effective when it was higher quality evidence. So they actually remembered the numbers the same, but they're adjusting the effectiveness in their minds. So that was kind of interesting. But what was really interesting is the one that had no label, they essentially treated it like it was high quality evidence. I mean, somebody's telling you. It's not surprising that most people assume that that's high quality evidence. So I think that raises a really interesting ethical flag that if you've got low quality evidence, as we often do, sadly, and you don't flag that to your audience, are you lying by omission? So I think that's something that we all have to bear in mind. And I just want to finish up with one other experiment that we did. So we pulled together what we called, we didn't call it, nature called it 5 rules for evidence communication. We don't like creating kind of rules, but these are essentially what we at the Winton Centre have kind of ended up moving towards as good principles if you're trying to inform people and not persuade them. So, setting out to inform people, not persuade them, setting out to be trustworthy. Inform people, not persuade them. Offer balance, not false balance, so that's presenting the evidence in a non-biased way. Disclosing your uncertainties, which we've done some work around as well. Stating the evidence quality, because we now know that if you don't, people make assumptions. And inoculating against misinformation, which I won't talk about because it's not my area, but we've got John Rosenbeek here who will tell you all about that. And so what we thought we'd better do is empirically test these and find out, do these, which we kind of think might affect trustworthiness, what do they do to the public audience? So we did an experiment that was funded by the UK Cabinet Office, where we took some current government communications around everyone's favourite COVID vaccine, but also nuclear power. Hurrah, something non-COVID. So their normal communications about both of these topics were hugely persuasive. It's the standard stuff about how great nuclear power is for, getting to carbon net zero, and how safe and effective the vaccine is. And we put them through our little filter, and we created alternative versions that were setting out to inform and not persuade. So they did all the things that we said they should. We tried to keep them the same length, same readability, all of those kind of things. And the first thing we did ask people to do was to rate on various things. So did they feel it was one-sided? Did they feel it was persuasive? Did they feel that it addressed uncertainties and evidence quality? And everybody was only seeing one of these 2 forms. So whichever one they saw, they rated it. And thank goodness, the informing one actually was doing what we thought it was going to do. So, people noticed the difference between the 2. So that was great. But what did it do when we asked them about trustworthiness? Well, the good planning thing was that we had asked people in advance what their prior beliefs were on each of those topics. And the reason that was useful is because it made a massive difference to their responses. So people who had positive views of the COVID vaccine or nuclear power didn't really make any difference whether they had the informing or persuading version, because they just thought it was very trustworthy, conformed with what they wanted in the persuasion way, maybe, but they just thought it was trustworthy. But for those who were anti-vax or vax hesitant or anti-nuclear, the version that was designed to be trustworthy, they saw it as much more trustworthy. So what I think is interesting about that is that even if you'd been setting out to persuade people, you'd actually have been undermining your own message because you're pissing them off, trying to persuade them about something that they've got strong beliefs the other way. Of course, their hackles are raised immediately. So I think the kind of take-home is that if you're setting out to change people's behavior, which I know some of you are, then people are extremely alert to your motivations. They'll spot that you're trying to persuade them. And the people that will most piss off are the people you're most trying to reach. So my message is kind of try evidence communication. It's not suitable for all circumstances, and I'm sure we can discuss things like public health situations and circumstances where you want more control over people's behavior because it affects other people. But generally, I think where people have an important decision to make, and it's an individual decision, and they're engaged enough already to make that decision, to look into it, to make that decision, because it's a really important one for them. You don't need to engage them, and you don't need to try and persuade them. You need to respect your audiences and give them the autonomy by giving them the information that they need in a balanced way. So I was going to end with explaining what this was. If anyone's worked it out. No? So Alfred's jewel, I found out as I was an adult. It's one of a set of objects made, ordered to be made by the Anglo-Saxon King Alfred, who was born in the town next to where I live. And what it is a reading pointer. So there would have been a wooden or ivory stick coming out of the beast's mouth there. And it's written down that what he ordered them for was because he ordered all of the important texts to be translated out of Latin. This is back in the 10th century. Out of Latin into Anglo-Saxon Old English, so the language that people could read. And he sent the books round the nation, accompanied by the reading pointer. And scholars think that the crystal in the handle is symbolizing clarity. So what he was trying to do was bring information to everybody in a way that they could understand it, translated for them, and with a pointer to help them read it. So I hope that's what you all can do over 1,000 years after King Alfred. Thank you.